I'm going to start. There we go. And it's open. Hello, everybody. Welcome to tonight's Kids Vaccine Town Hall. And we'll just let everybody join and ask the experts with Dr. Janine McCready of Michael Garron Hospital and Councillor Joe Cressy, who is the chair of the Toronto Board of Health. We'll just give all your friends and neighbors a chance to join us. While we're letting everybody join, just let you know that we will be having Q&A is how you're going to put your questions in. We have had quite a few people send in questions ahead of time. Thank you very much for that. And we'll be answering those. Our experts will be answering those during the course of this Kids Vaccine Town Hall. And thank you for your interest in this. And I want to thank our experts for being with us tonight to give us this info. Just give a chance for people to join. Great. You know, we'll just let people join and we will have a chance here for other questions. We've just had a question come in. I think that would be a very common one about this new variant and what's going to happen. What's going to happen with this vaccine. So that's going to be one of the questions, but we're very lucky tonight to just ask you to put up that agenda tonight, please, Nick, that we're going to just welcome you all for tonight. And we'll have, of course, our land acknowledgement. I'll introduce you to who's going to be speaking tonight. Dr. McCready will be making a fantastic presentation and very detailed about COVID, vaccines, and children. And then the chair of the Board of Health, Councillor Joe Cressy, will be joining us. And then you'll find how to book an appointment, which you might already know, and we'll have our Q&A. So probably about a half an hour presentations, please sit through that. And then we'll get to your questions. And I can see that a number of you are very interested in the aspect of this newly announced variant and about vaccines and your children. So thanks so much for being here tonight. And we'll just go to the land acknowledgement. Of course, we acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Thank you very much. And here are our expert panel tonight. It is Dr. Janine McCready, Infectious Diseases Physician at Michael Garron Hospital, and Councillor Joe Cressy, Chair of the Board of Health. And before I turn it over to you, Dr. McCready, I just want to, on behalf of everyone in the East End of Toronto, thank you so much for your incredible, dedicated work around vaccines and COVID. You came up with the brilliant idea to vaccinate in the schools, vaccinate the teenage population there, and they flocked to schools. It was a brilliant idea. You're truly a community builder, community advocate, and a great doctor, and we're so proud to have you in our community. And with that, thank you for taking time out tonight to spend with people on vaccines and children, and I'll turn this over to you now. Thank you.
Perfect. Thank you so much for having me, and thank you for everyone who's joining to hopefully get their questions answered and be able to make a decision about, if you have young ones in this age group, a decision about which way you want to go and if you want to get your children vaccinated now. So let's get started. So I'll tell you a little, or you can go to the next slide, and I'll just tell you a little bit about myself. So as Councillor Fletcher has said, I'm one of the infectious disease doctors at Michael Garron, and so before COVID, I was mainly within the hospital and spent time taking care of people with all kinds of infectious diseases. And then when COVID hit, we very quickly realized that this was a disease that was going to be really in the community, and we were going to see lots of cases. So I had the opportunity since last August. We started reaching out to the schools in East Toronto and really forming a support network for the schools, for the principals, and for the teachers, really trying to make their lives easier, to try and translate all the data and translate all of the advice that they were getting into local solutions and what they could do, and really trying to make testing easier. So with the work of my colleagues and other brilliant people at the hospital, we came up with the ability to create an easy way to swab kids. So if any of you are taking your kids for the oral nasal swab, so the swab that just goes in your mouth and nose, so we really quickly at the beginning of this realized we needed another strategy to be able to test them. So we put that through the schools, and we've really seen, not only in the hospital but outside, how much this has affected kids. And so that's why I think these vaccines are very important, and it's really important to me to get the information out to all of you so you can make these decisions. And on a personal level, I do have 2 little munchkins of my own that are in this age group, and they were fortunate enough to get vaccinated on Saturday. So they were thrilled. They had a little countdown going, at least the older one did. The younger one's a little bit more reluctant about needles, but they got their shot and they felt totally fine, actually, even less side effects than they had with the flu shot. So, on a personal and a professional level, I really, I think that this is a good step forward for us. And I practice what I preach, basically. So let's get started talking about more about this COVID-19 vaccine. So what do we know so far? So basically, as of September 20th, after months of clinical trials, Pfizer said that their COVID-19 vaccine for the 5 to 11-year-olds was safe and effective. And a month later, on October 18th, they submitted their data to Health Canada, asking for the agency to approve the vaccine for this age group. So Health Canada and NACI poured over the data. They asked for more data. They reviewed everything they had. And then on November 19th, so now just about 10 days ago, they approved the vaccine in this age group. And the same day as that, NACI also made recommendations to approve this vaccine in this age group and make it available to Canadian children. Then on November 22nd, so just a week ago, the Ontario government announced that children age 5 to 11 will be eligible to be vaccinated. And then on last Tuesday, on the 23rd, that's when they opened up the big booking links online so that kids could start booking. And there was about 10 kids that were vaccinated in Toronto last Tuesday. And then a lot of the clinics opened up in the following days. We started our first clinic at the Thorncliffe Park Hub in East York on the Thursday and have been vaccinating kids all weekend. And a lot of the jurisdictions across Ontario have been doing the same thing. So we've, I think so far, and Joe Cressy would probably have the up to the minute numbers for us, but from what I've heard, there's been about 6,100 kids vaccinated over the first weekend, which is a great start. And about 14% of the kids in Toronto have actually already booked vaccine appointments, which amounts to almost 30,000 kids, which is amazing out of the total of 200,000 kids. And the one thing I just wanted to add in terms of that that timeline is that so the United States is a few weeks away apart in front of us, which we never wanted them to be ahead of us, but it actually will work out in our favor in terms of making these decisions as we go along and giving us real life experience. So they approved the vaccine on October 29th, and then the CDC approved it for use and recommended use for kids on November 2nd, and they started doing vaccines on November 3rd. So as of November 18th, they had actually vaccinated over 2.6 million kids, and I think it's up well over 3 million kids now. And they're actually, some of the kids that got their dose the first day are actually able to start getting their second doses already. So we can talk about how that's helpful for us a little bit later to get some real life data and the data that we have from the study combined with that. So I think one of the most basic questions is, why is it important for children to get vaccinated against COVID? So we have heard a lot through this pandemic that COVID's not very severe in kids. Most of them have mild illness. It's not a big deal. So why would we need to vaccinate them? So the thing is that we are lucky. In most cases, kids do have mild disease, but there is still a risk of severe illness from COVID-19. And so they can get a risk of severe illness from acute COVID, but also from other complications from it, including something called multisystem inflammatory syndrome. And so in Canada, there have been, just in Ontario, there's actually only been about 2 deaths in that age group, which is low, but still avoidable. And in the United States, there's been 66 deaths in the 5 to 11 age group, which is, obviously higher than a lot of other medical issues, and if they're preventable, that's something we really want to prevent. And in the United States, about 8,600 kids in this age group have been hospitalized with COVID over the last year, and a full 30% or a third of them have actually been completely healthy kids with no medical complications or no other medical issues. So really, it's taking a risk that if we have something safe that will protect them from that, certainly that as a parent, I want to do everything possible to prevent my kids from getting sick. And when I talk to other healthcare providers who have seen kids sick with COVID, the one thing that really does worry them a lot is this multi-system inflammatory syndrome. So it's hard to predict, and it can happen even after mild COVID, and it happens about 2 to 6 weeks after a COVID illness. It's rare, so it happens in about 1 out of 3,000 or 200 to 3,500 kids, but it causes inflammation across multiple parts of their body and can make them very sick. And if they develop it, about 60 to 70% of kids end up in the ICU, and 1 to 2% end up dying. So it's fortunately rare, but if you think about on a scale of, as we continue to open up, if more and more kids get exposed and more kids get sick from this, it's certainly something that I want to do everything I can do to prevent it as a mom and also as a physician. Then there's also the risk of post-COVID or long-term complications. So the estimates are somewhere between 1 and 7 to 8% that kids develop post-COVID or long COVID, and those can create longer-term issues for your kids. And that can happen even after mild disease. So if you can prevent that altogether, certainly another reason. So really protecting your child's health is important. It's not all about the community and other people. It's about them as well. The second thing is it protects the vulnerable people around them in your household. So if you have younger children who can't be vaccinated, or seniors that are, or other people with immune compromising conditions where they might be vaccinated, but the vaccine might not work as well, those people would really benefit from, not having COVID introduced into the home, because we know kids can obviously get COVID and they can definitely pass it on to vulnerable loved ones, which can have, devastating effects for your family. The third reason I think about vaccinating my kids is really to get them back to being able to be a little bit more normal. So not having to worry about school disruptions. We know how much, anyone that has kids or is around kids knows how much the school disruptions have really impacted.
I think you're fine. We can hear you.
Sorry, my screen just disappeared. Sorry.
Okay.
Sorry,
it's okay.
That was something else just came up. We know how much it's impacted kids. So really being able to, not having to be worrying about being dismissed from school if you're fully vaccinated, being able to participate in all those sports, have sleepovers with your friends, go to birthday parties without fear of, is someone going to get COVID? Is there going to be exposure? I mean, that's huge for kids, their development, their happiness, and their mental health. And then the last thing is it really does help, everyone in the community. And I think that, every person that decides to get vaccinated and makes that choice, and they're, especially for kids, they're little superheroes. They're going to contribute to making it safer for everybody else and helping us move forward with this. Next slide, please. So this just illustrates kind of that point that I was talking about in terms of the risk of COVID in kids. So as you can see in the last column with COVID in the 5 to 11-year-olds in the last year in the United States, there's been 66 deaths in kids. And so this is just comparing to other vaccine preventable illnesses that we routinely vaccinate kids for. And these are the number of deaths that happened in the years before the vaccines were available in those groups. So these are things that we routinely would vaccinate our kids for, and most of them have a fraction of the number of deaths in the years preceding vaccines than COVID does. So certainly COVID vaccines are useful to prevent illness in kids in an individual level. Next slide, please. So this is just, I'm going to talk a little bit more about the trial and then go into kind of risks, benefits, and safety stuff. So basically what they did in this trial is they had initially a phase 1 part of the trial where they wanted to figure out what the best dose was. So in adults and in 12 plus, so in youth as well, the dose is a 30 microgram dose. And so in kids, they wanted to see if a smaller dose would provide just as much robust immune response, but would be able to reduce the risk of side effects. So they compared a 10, 20, and 30 microgram dose, and they realized with the 10 microgram dose, shows it would produce a good, strong, robust immune response to protect them and give them protection against COVID, but also reduce the side effects. So they moved ahead with that smaller 10 microgram dose into the studies. And in the first phase, they gave about 1,500 kids the COVID vaccine and another 750 the placebo. And then those kids were randomized and they followed them. And then at the end of that, they actually went back and they enrolled another 1,500 and another 750 of placebo. So there was about 3,000 kids age 5 to 11 between those 4 countries that received the Pfizer vaccine in the study. And they were followed for at least 1 to 2 weeks and many for 2 to 3 months. And now it's been an additional 2 months since the study ended. So they're still following those kids for any other unusual side effects. Next slide, please. So this is just to summarize that really the safety and efficacy of the COVID vaccine, that the benefits of the Pfizer vaccine outweigh the known and potential risks. And so Health Canada and the CDC and the FDA and NACI have all gone through this analysis, and that's why they've recommended and they've permitted or approved the use of these vaccines, because the benefits of preventing COVID in kids is less than the potential risks. So the regimen for kids is a 2-dose vaccine series with 2 child-sized doses, so 2 10 micrograms doses, which is a third of the adult dose. And in the trials, it was administered 21 days apart. So here in Canada, NACI's actually recommended an 8-week dosing interval because basically based off of a lot of data that we have from adults with an increased dosing interval that will provide you with a more prolonged protection. And then the other reason that they've suggested that prolonged interval is there's emerging evidence from Israel when you look at a prolonged dosing interval in youth and in younger adults, that the risk of side effects such as myocarditis is actually lower with that increased interval. So another reason that they suggested the 8 weeks. So it's officially approved for 21 days, but the province of Ontario has suggested that the rollout should be at a recommended 8-week interval. And in the study that showed that 2 doses of the Pfizer vaccine was 90.7% effective at preventing lab confirmed symptomatic COVID infection. And this included when the Delta variant was circulating. So the Omicron was not circulating yet. That we still have to learn about this virus. So we don't know how well the vaccine will hold up against this new variant, but we do suspect that there'll be at least protection against severe disease. But again, this is so new that we are really just like literally learning every minute, or we're getting new information about this from different countries. But we suspect at least it'll have some protection, as it would be unlikely to develop a variant that would completely escape vaccine immunity at this point. And in the trial, none of these adverse events were reported by participants. So there was no myocarditis or pericarditis. The trial was small and it was not powered to detect very small and very rare side effects, but still they did not see any cases of this in the trial. There was no anaphylaxis or hypersensitivity or severe allergic reactions. Obviously it was short term, but there was no discernible impact on development or fertility in the trial, and no cases of multi-system inflammatory syndrome or severe COVID. The most common side effects they did see were pain in the arm, fatigue, headache, muscle pain, and chills. And I'll talk a little bit more about those in the next few slides. Next slide, please.
Dr. McCready, can I just interrupt 1 second? And we've had a question about whether or not you should get your child's flu shot. What's the timing between the COVID and the flu shot? Is this a good time to answer that, because you're talking about the 8 weeks?
Sure, yeah, we can talk about that for sure. So really what Health Canada and NACI have said is that ideally you separate out the 2 shots by 14 days. And that's really just a precaution. So just in case your child has any side effects, at least we can separate out the doses and you know what is causing it, and it won't be, confusing, or they will have less side effects because you're separating out the doses. So ideally 14 days, if you have an appointment booked and it's like 10 days or 11 days separate, or I wouldn't cancel your appointment. There's no major risk, but ideally 14 days, and it's just a precaution. So what I would suggest is, because there's way more COVID circulating than flu, I would get my COVID shot first, wait 2 weeks, and then get the flu shot. And then you'll still be able to get your second dose at the 8-week interval. So you can get your flu shot in between the 2 doses of the COVID vaccine. That's no problem.
For clarifying that.
Yeah, no problem. And then, so in terms of the safety here of the COVID vaccine, so this is really just in terms of local reactions. So the main thing that kids experienced was pain at the injection site. So just a sore arm. And after the first dose, it was about 74% of kids, and after the second dose, about 71%. But as you can see on the slides, it actually they compared the rates of side effects to the 16 to 25-year-old cohort who got the 30 microgram dose, and their pain at the injection site was actually higher in the adults. And so that's partly likely due because, kids, their immune systems are amazing, but they got a smaller dose. So really kind of mild pain at the injection site and a little bit of redness and a little bit of swelling. So very generally mild symptoms there, and self-resolved. Next slide. In terms of more systemic response, so again, this was compared to the 16 to 25-year-old groups who got the 30 microgram dose. So in all the categories, the kids again had less side effects. So only about 6% of them developed a fever, 40% developed fatigue, about 30% headache, 10% chills, and about 12% muscle aches, all compared to much higher rates in the adults. So up to 65% got fatigue in adults, 61% headaches. So the kids generally had less symptoms after it. And again, these were very short-lived, usually lasting kind of 1 to 2 days. And honestly, my people were bouncing around. One of them went to basketball on Sunday morning. We built a snowman on Sunday afternoon. There was really, I think they had more energy because they were so excited that they got their COVID shot, if anything. So, some kids might feel a bit lousy. And if they're feeling really lousy, you might want to, keep them home from school, let them sleep a little bit more, but generally would not expect them to have any, to feel unwell at all really after the dose. Next slide.
Could I just ask one other question while you're going through, because you're kind of touching on things that people have asked about. One of them is about the weight differences between a 5-year-old and 11-year-old and the 10 micrograms. And they're wondering, is it okay to have the same for the 5 as the 11-year-old because they weigh so much less?
Yeah, perfect timing. So this slide is here to answer that exact question. So this slide is looking at the immune system, and so the immunogenicity of all the different kids in the study. And so what they did is they not only, you can see in the first column, that was all kids, but they also separated it out by age. So the first column was 5 to 6-year-olds, then 7 to 8, and 9 to 11. And so the thing to remember about the immune system, and especially about immune system in kids, is basically it's more about the maturity of your immune system and your age. So not based on weight. So it's about how the specific vaccine interacts with your immune system and produces an immune response. So it's not about if you have a 120-pound 11-year-old or a 20-pound 4-year-old. It's really about the age and the maturity of your immune system. And so with some different vaccines, sometimes kids get a higher dose than adults, and sometimes kids get a smaller dose, and some kids get the same dose. So because that's why they did the studies, to figure out what the best dose was, and then they did separate it out by age. And so here it shows that the numbers specifically aren't, the take-home point. It's more that you can see that across all the age ranges, that the response, the immunogenicity, or that that antibody titer was similar across all the age range. And they compared these titers to the 16 to 24-year-olds to ensure that they had produced an adequate immune response to protect them against severe disease from COVID and protect them against, to mount antibodies to protect them against, minimize the risk of infection. So you can see that the first column in all of these is just their baseline, so day 1, and then the second column is 1 month post dose 2. So all of those different age groups had a robust and a good immune response to the 10 microgram doses of vaccine. And so, my little person, for example, she's 4, she actually turns 5 in 2 weeks. So because for Ontario, anyone that's 4 turning 5 in 2021 was eligible, she was eligible to get her vaccine. And she's tiny, she weighs like 20 some pounds. And she would get the same dose as someone that was 11, that was the same size as me. And in the study they looked at their age, and you don't need to take the weight into account there. The other question we get a lot is, if they're turning 5 sometime in the next year, when can they get their dose? And so part of that is going to depend on kind of how the government rolls this out, or how the public health units roll it out. For right now, only kids that are turning 5 in 2021 are eligible or are already 5. So when we get to 2022, I think we're going to have to see how they roll it out. Health Canada and NACI have suggested that the children actually have to be 5 to get the dose, because there is other studies coming in the kids under 5. So Pfizer and Moderna are both doing studies in the younger cohorts up to 5 years old. So we'll see if the government introduces any kind of, like, if you're born in the first 3 months of the year, or by quarter or anything, or if you actually have to be on your 5th birthday to get the dose. And that's what we've heard from Health Canada and from NACI, that's what they suggest. At the other end of the spectrum, if you have an 11-year-old who's turning 12, what do you do? And I would certainly not wait for that 12-year-old dose. I would get their first dose now with the 11-year-old dose. And based on the studies, it should show that it does show that they're getting a good immune response. And then if they turn 12 in between the doses, so say their birthday is in January, they'll get the 11-year-old 10 microgram dose now. And then for their second dose in 8 weeks, they could get the adult dose, the 30 microgram dose. But would certainly could get the dose soon, because we are seeing rising levels of COVID across the province, and certainly in the 5 to 11-year-old cohort, because these kids are at school, they're participating in activities, and the numbers are certainly rising. And I mean, every day we call more kids, and a lot of people have so many exposures. So I would get it as soon as possible for those groups. Next slide, please. So we're winding down here. These are kind of where to get your COVID-19 vaccine for children aged 5 to 11 in East Toronto. So you've got a number of options. So one of the options is if you go onto our website at thn.ca/vaccine appointment, or you call that number, and you can book an appointment at the Thorncliffe Park Hub. So we have basically created a kid-friendly clinic there, and really just to make sure that we're catering to the kids and that there's no chance we're going to give any kid an adult dose or any adult a kid dose. We've made that clinic all for 5 to 11-year-olds right now. And so that's where we went on the weekend, and it's all got nice decorations, and there's these child life workers who one person said on Thursday that it was more fun than their last birthday party, which either they need to have better birthday parties or we're really doing a good job over there. So that's one place you can go. So it's over in the East York Town Center is where that clinic is for kids. So not too far within the area. And then the other place to book is on the provincial booking system online. So all of the Toronto Public Health and City of Toronto clinics are all available on there. The nearest ones to the East End are kind of either downtown at the Metro Convention Center or in Scarborough at Scarborough Town Mall. So it's a bit of a hike depending on where in the East you are, but the Thorncliffe Park Hub is nice and close. You can also use the pharmacy locator to find a pharmacy near you that's offering the vaccine, and also a family doctor or a pediatrician. They may be offering them. We are also doing mobile clinics at schools. We're starting at priority neighborhoods that have been hardest hit by COVID. And so we've already started doing clinics. We had one on Friday, and then 2 on Saturday, 2 on Sunday, and another 2 today. And we'll be continuing to ramp up, visiting schools kind of across the East, starting with the schools that have been hardest hit and looping back regularly. So people that don't have access to a car and are comfortable at their local schools, that's where we'll be able to reach them. And they're all by walk-in. So we are booking some appointments for families by doing outreach through the schools and actually calling families to make sure that they know about the clinics, but also available to just come on in if you're near those places and you've been advised of them and would like to come. And most of those are being advertised very locally through the principals and through the local community. But again, if you're close to one of these schools and you see a clinic and you want to get your child vaccinated, by all means, please take advantage. Next slide. And in terms of, and we get this a lot too, like how do you help your child have a comfortable vaccination experience? So a lot of them by this point have had a number of vaccines, and I think the response to vaccines for kids is wildly diverse. Some kids are no problem, and other kids are very afraid of needles. So figure out what works best for your kid. Is it best that they have an appointment where it's predictable and that you can kind of adjust their experience for them? Or are they happy going to their local school, or would they rather go see their pediatrician or their family doctor? So, figure out what will work best for them, and talk to your kids about the vaccine experience and why it's important, and acknowledge why they're concerned and how to make that better. I think there's kind of a balance between not talking about it too much and scaring them, but just know so they know what to expect. when you actually come for the vaccine appointment, great to dress your child in comfortable clothing and something that is easy to access this your upper arm, because if they have to take their sleeve out, often they get cold and then they're already on edge that they don't want to get vaccinated. And then let them bring something that makes them feel comfortable, so a blanket, a stuffy, and then I think for a lot of kids, something to distract them. So you have something on their phone that they can watch, a little fidget toy, something. We've got a lot of distraction things in child life workers at the clinic, but something that they're comfortable with is always great. And if your kid's really worried about or has issues with getting the vaccine, then a topical numbing cream or a spray or a patch can also be helpful. And then afterwards, they may not need anything for if they're feeling fine, but they may benefit from getting a little bit of Advil or Tylenol if they're feeling not so great. And then at all the clinics, you're welcome to have your child sit on your lap, sit however is comfortable for you. So they can face you, they can face out, however, they feel comfortable. The vaccine staff at all the clinics are trained to really make it the best experience for you. And so, you can be with your children, both parents can come. We went it was our family outing on Saturday. So me and my husband and the two little ones went, and my 8-year-old helped my 4-year-old be distracted. And it was honestly, the needle that they're using too is even smaller than the usual needles, because it's only a 0.2 milliliter dose of the vaccine. So the needles are smaller. So they actually, my 8-year-old didn't even notice. He was like, "Are you sure you did it? Or I didn't even feel it." So it's actually, it was less painful for most kids than a flu shot because it's a smaller needle. Next slide. So yeah, the kind of what to expect afterwards. So the most common temporary side effects, as we talked about, are just pain in the arm, fatigue, headache, muscle aches, and chills. But again, a lot of kids, less than half will actually experience those. And the pain in the arm is probably pretty common. I mean, between 70 and 75% of kids probably get that. If your child has any side effects that you are worried about or you think are not normal, please contact your child's pediatrician or your family doctor. And if they're very unwell, then obviously call 911. That would be very unlikely to be related to the vaccine. But if it does occur, just like with anything with your kids, don't hesitate to get them checked out. And if you need that reassurance. And so, we know that the COVID vaccine is very effective at preventing and reducing the risk of developing COVID, but it's not 100%. And certainly after one dose, you're not wearing a bulletproof vest. So it's really important to still follow public health guidelines whenever possible. So wearing a mask, staying at least 2 meters away from other people if you're out in a big group, avoiding busy or crowded places, and especially if you're in a group with mixed vaccine, know their vaccination status, or some people are unvaccinated. And importantly, if you're having symptoms or you've been exposed, please stay home and get tested. And as always with everything and heading into flu season and all the other viruses, wash your hands often and avoid touching your face when you're out. Next slide.
Dr. McCready, can I just ask this now? If a child has had COVID, should they still get the COVID shot?
Yeah, great question. So yes. So the answer is yes. If there's good data most of the data is from adults, but we have seen reinfections in kids too. And the protection from the vaccine is definitely more durable, and it protects against more strains than having COVID itself. So what we recommend generally, usually public health will tell you it's fine to get vaccinated anytime you come out of isolation. When I think about it, understanding the way the vaccines work and the way our immune system works, I usually recommend to parents waiting about 1 month from when they've had COVID. And then anytime after that would be fine to get vaccinated. Because if you wait a month, they've recovered, their body has improved post-vaccine, and then they've had a chance to mount some antibodies. And so at that point, if you get them vaccinated, it's just going to boost that natural response. So, waiting about a month, even, 6 weeks, somewhere in there is totally reasonable. But anytime after that would definitely be recommended to still get that vaccine.
Thank you.
No problem. Great question. And some of these this is just some helpful resources. So if your kid's a bit worried about getting needles, there's this system, how to cope before and during vaccination. So the comfort, ask, relax, and distract. And needles don't have to hurt. And if I appreciate everybody coming here and listening and getting answers. But if you want to have a one-on-one conversation with a health professional about either your kids or yourself or your teens, the Sick Kids has a vaccine consult service for children, youth, and families that you can talk to a healthcare provider one-on-one and get all your questions answered. And then Scarborough also has a clinic hotline called VaxFax, and they're open. You can self-refer, and obviously great to reach out to those services, and then have a conversation with your own healthcare providers. Really, we want you to feel comfortable that you've had the answers to your questions, and you feel comfortable vaccinating your kids. And I think an important thing, I mentioned it a bit at the beginning, is that we have all this data from the studies, but now there's 3 million kids in the United States that have also been vaccinated. So, and there's been, we get updates regularly from the CDC, and NACI meets and gets that information. And there's been no reports of any different or unusual safety signals in anything, which is obviously very reassuring that literally millions of kids have now received their first dose as we start to embark on this. Next slide. And then this is just our last, and this is my last slide. So just kind of not speaking specifically about vaccines, but just about other supports and child-friendly things here in East Toronto with East Toronto Health Partners and Michael Garron. So we still have a lot of testing and COVID outreach centers across the East. So these places are available by walk-ins. They all have the child-friendly oral nasal swabs that kids can get there, or you can pick up our take-home kits and bring them back. And you can see a physician or a nurse there as well. And also vaccines are available at a lot of them for over 12. So the kids' vaccines are just available at Thorncliffe right now. And we also have our main site where the same thing. And then we also have a child and youth friendly emergency zone in the emergency department. So where your kids can get checked out, and it's a special place for the kids to try and give you some kid-friendly care. And I think a lot of people I've heard had a million texts today worried about the new variant Omicron, and I'm not even sure I'm saying it right yet because I haven't officially. We're still learning so much about this as we go, but it's still important to do all of the same things that we've been doing. So it's still important to get vaccinated, wear our masks, get tested, avoid crowded places, stay home when you're sick, all those things that we know have helped to protect us so far. They're still going to be, as important and even more important with as we start to see, as I'm sure we will, as we start to see this new variant arise in Toronto. Okay, next slide. I think that might be the last one.
I think so, yes. Oh, how to book an appointment. There you go.
Perfect. So yeah, so I mentioned this a little bit, but you can either, there's a few different ways to book. So you can book at the city run clinics at toronto.ca/COVID, or by calling the provincial booking line. And then there's also if you Google like COVID booking Ontario, there's a provincial booking site. And then for our clinics at the Thorncliffe Park Hub, you can book with this special family friendly clinic at than.ca/COVID-19 vaccines. And then, as I said, there'll be school clinics throughout the East. And so you'll get notified kind of through your principal in the area. And then also we've been trying to get those messages out to local partners in the area to spread the word as well. So even if your kid doesn't attend that school, but you go to a school in the area or you live in the area, you're still welcome to attend those local school clinics.
Thank you. Thank you so much, Dr. McCready. And we'll be back to you. We've got quite a few questions. So really thank you for all your spectacular work at Michael Garron. And it's so good to know that the clinics were starting back up at schools, because that is what you started last spring at the high schools and just regular many schools in the East End, and it was spectacularly successful. So thank you very much. And we'll put you on standby for some of these great questions. Now, I am going to introduce our current chair of the Board of Health, that's Councillor Joe Cressy. I do want to say that we have a former chair of Toronto Board of Health with us tonight, and that's our MPP, Peter Tabbins. He led the Board of Health when the smoking introductions in the city that went on to be a provincial. And so we've got a lot of stars here on our call. Thank you, Peter, for being with us tonight. And I'm just going to introduce our indefatigable Board of Health chair. He's the ever ready Energizer Bunny, who has been from day one out front, leading on vaccines, leading on information. And I'm very pleased you took the time tonight to be with us tonight on this call, Joe. So I'll open it up to you, and please let us know all that you can tell us. Thank you so much.
Well, thank you, Councillor Fletcher. Let me just say, Paula, as I know we all know you as so well, It's a delight to be here. I'll try to keep my remarks relatively brief, but perhaps let me just start by saying I sincerely hope everybody who's joining us from your living rooms and dining rooms, I'm at a dining room table with a kid who's in the bathtub 20 feet from me. I hope you're okay. And let me also begin by thanking Councillor Fletcher for hosting this meeting and for being here tonight. To those who've joined, you all know Paula deeply well. Paula's a mentor of mine. And so when she said I'm hosting a meeting for my mentor, I'm always here. And Dr. McCready, holy cow. I mean, you want to talk about superstars in our city? You just heard from one who has been a superstar in this response, not just in the East End, not just in Toronto, but in Canada for 2 straight years. And so we are in the presence, frankly, of one of the country's experts here. Let me just take a few minutes. Dr. McCready gave you the nuts and bolts around the vaccine, the safety, the efficacy, as well as the rollout in the East End. Let me paint a citywide picture for you briefly. We talk a lot about Team Toronto. Team Toronto is a partnership. It's the City of Toronto, it's Toronto Public Health, it's hospital partners like Michael Garron, it's community partners like the Thorncliffe Neighborhood Office, it's local officials like MPP Tabbins and Councillor Fletcher. It is a giant team effort to get our city vaccinated. And here are the results thus far. Nearly 89% of residents of Toronto over the age of 12 had had their first dose. 89%. More than 85% of Torontonians over the age of 12 have had 2 shots. That's 2.4 million people who are now fully vaccinated in our city. And we have a target in this province and city to reach 90% fully vaccinated for those over the age of 12. 2.4 million are fully vaccinated. To reach 90%, we have 126,000 people left to go. It's remarkable. I have to tell you, for cities more than 2.5 million people, Toronto is now one of the world leaders. And the credit for that goes to this huge team approach, but it really goes to Torontonians. I mean, it's Torontonians. You've rolled up your sleeves, you've got your shots to protect yourself and to protect those around you. I mean, what an incredible act of civic responsibility and civic community. So that's Toronto. The Team Toronto Kids campaign. This is what we're referring to our 5 to 11-year-old campaign, Team Toronto Kids. We have 200,000 kids in the city of Toronto between the ages of 5 and 11. I can tell you that as of today, tens of thousands have already booked their appointments. 6,000 kids got their first shot in the first 2 days, just the first 2 days. We're off to an incredible start. And here's what the model looks like. Dr. McCready talked about a clinic model that has city-run clinics that you can book at toronto.ca, hospital clinics like at the Thorncliffe Park Community Hub. I was there on Saturday with Mayor Tory. It is remarkable, so well organized, so calm. There were kids' videos playing in the aftercare area. It was spectacular. More than 240 pharmacies in our city are now delivering vaccines to kids, and that will be going up to 450. 130 doctors' offices and family health teams are now administering vaccines. And as Dr. McCready mentioned, there's a huge push for in-school clinics. There are 230 in-school clinics that have been planned for the next 3 weeks, which are taking place in 34 target neighborhoods as a first start to service 55,000 kids. Those school-based clinics started last Thursday. They'll be rolling out, as I say, 230 of them in the next 2 to 3 weeks in 34 neighborhoods, and they're going citywide. But the bottom line, there are lots of clinic options, and it's whatever you find most comfortable and accessible to you. That could be a pharmacy, it could be your doctor's office, it could be at the Thorncliffe Park Community Hub, or maybe it's at the school. We want to make them as accessible as possible. There's a huge push in our city alongside clinics to do education and outreach, webinars like the one Councillor Fletcher is hosting tonight, telephone town halls that are being organized citywide, but also on the ground outreach. We have 155 community agencies, from the Thorncliffe Neighborhood Office in the East End to the Rexdale Community Health Center in the West End. 155 community agencies are going door to door, building trust, answering questions. And I want to tell you, critical to this campaign is an equity focus. We saw early in the vaccination drive for adults that some of our hardest hit neighborhoods were the least vaccinated early on. We're trying really hard to flip that. We're taking the school-based clinics to those hard-hit neighborhoods first because, listen, we want to protect the most vulnerable as quickly as possible. Let me seek to just wrap up there by saying on a broad level when it comes to vaccines, listen, ultimately, especially for our kids, I have a 2-year-old. I'm really hopeful that vaccines will be eligible for him early in the new year. But for our 5 to 11-year-olds, we want to protect them. We want to protect their health. But vaccines are more than about individual protection. They're about population health. Vaccines are how we protect each other. They're how we protect those who are immunocompromised. They're how we protect people in more vulnerable situations. It's about population health. It's about all of us doing our part together in a safe way, following the science. And so with that, I'm going to turn it back to Councillor Fletcher. Again, I'll just say my mentor to facilitate the Q&A, and it's an honor to be part of this tonight and happy to answer any questions, though I suspect I'm going to defer to Dr. McCready because I just talk. She actually knows what she's talking about.
Well, I have one for you, Joe Cressy, Councillor Joe Cressy, Chair of the Board of Health. And someone said at the Scotiabank Vaccine Day, which is a really big deal, and you've talked about that on December 12th, will they be, who's going to administer those shots? And there's the visual there. It's a big day. One of those ones you like to have so many people come to. Someone wants to know who will administer them. Will they be professional? And what's the difference between that and going to a hospital? And I think that's a good question because usually you go to the Scotiabank Arena to watch sports and now you're going to get your vaccine.
So, well, listen, I'm glad you raised it. And there's the graphic you can all see on the screen. So we just announced this morning that in partnership with Michael Garron, Sick Kids, the University Health Network, we at the City of Toronto are hosting a clinic at Scotiabank Arena. It's on Sunday, December the 12th. And you can register. It's for 5 to 11-year-olds. You can register at toronto.ca/COVID-19. At this clinic, our partners at Sick Kids, Toronto Public Health, as well as Michael Garron and University Health Network, trained professionals will be administering the shots to kids who are 5 to 11 years old. But I want to tell you what's really exciting about this event is our whole kids vaccination campaign. It's about making vaccines accessible, but also creating a positive and welcoming environment for our kids. I mean, let's be clear. I mean, these are 5 to 11-year-olds. I mean, getting a needle can be scary. And so you want to create an environment that's both welcoming, but also positive. And so at the Toronto Kids Vaccine Day at Scotiabank Arena, we have lots of special guests who are going to be there, from Carlton the Bear, the mascot for the Leafs, to the Raptor. We're going to have lots of personalities. There's giveaways, there's entertainment. And this is all about creating a special and positive environment for our kids. You know, some of our kids want to be part of, getting their shot on the ice where the Leafs play or the hard court where the Raptors play. And that's what this is about. But the people administering the shots, it'll be the pros from Sick Kids, Michael Garron, UHN, and Toronto Public Health.
Thanks for answering that. And I'm assuming that parents can go with their children, or as Dr. McCready said, her whole family went. You're encouraging that for that day, are you?
Absolutely. So people can register online for your kids, but of course, these are 5 to 11-year-olds. And so we're doing this as a day-long clinic. Some of you may remember we had a Scotiabank clinic in June where Toronto set a world record for the most number of doses in a single clinic in one day, 27,000. This clinic's different. We're not trying to break world records. Rather, we're trying to create a really positive, welcoming, and fun environment for kids. So we have about 2,000 spaces. We've just opened up. So it's not going to be busy. It's not going to be crowded, but rather it's going to be really positive. Families are welcome to come down with their kids. Of course, it's all going to be safe and managed well with masking and distancing. But this is a special event. I got to tell you, if my kid was 5 and not 2, this may be where I would be taking him.
Thank you. Dr. McCready, a question for you is, has it been proven at all that kids who've already had COVID-19, and we know there's a parent on tonight that child has had COVID-19 and was wondering about if they could still get vaccinated. Wondering if they've had COVID-19, do they have some level of immunity against the virus, which would do them, or should they get the vaccine in order to have complete immunity?
Yeah, so good question. So in the study, the kids that got vaccinated, they did include some kids with that had a history of COVID, and they still showed that their immune responses improved after they were vaccinated. We don't have large studies of a number of kids that have had COVID and then following them to see if they're more likely to get reinfected than counterparts that have been vaccinated. We do have that data from adults, and we know that if people are vaccinated even after COVID infection, they're more protected, and they're likely more protected for longer and against more strains of COVID. So, I think again, it's kind of a risk benefit analysis. So they likely have some protection, but we've seen people, they can develop COVID again. And the vaccine really will provide them with protection for longer and more robust immunity. So I would still recommend doing it. Nothing, you don't have to rush out and do it if your child has just had COVID, and there's going to be lots of more data rolling in from the United States in the coming weeks. But certainly, based on all the evidence we have from the 12 plus group, it likely is going to provide you with longer protection with the vaccine as opposed to just from having COVID.
And could you answer another question about, there's a child who's 6 years old, and this child has had an allergic reaction to Twinrix and hepatitis A and B vaccines a number of years ago, I guess when they were 2. What are the chances, how should this parent have a conversation? Who should they have it with about any kind of reactions to the COVID-19 vaccine?
Yeah, good question. So, from the 12 plus and even from the kids, we have not seen reactions to the COVID vaccine in people that have had reactions to other vaccines. That's because the components are generally different in the COVID vaccines than they are in other vaccines. So the mRNA component is different, and then the buffer that it's in is different. So usually the only people that we're seeing allergic reactions are, or they have an allergy to something called PEG, which if you've ever had a prep for a colonoscopy, that's when you might have been exposed to that, but it's not something that kids would normally be exposed to. So generally, if kids have had a reaction to other vaccines, or if they have egg allergies, or penicillin allergies or peanut allergies, they're totally fine to get the vaccine and would have a low risk of reaction. If you're concerned, completely reasonable to have a conversation with your physician about that. And they can always refer you on to an allergist if you're really worried. We do have allergy clinics that have seen some, they've been seeing adults, and then some of them will actually even give the vaccines in those clinics. Generally, the allergists say that if you, as long as you haven't had a reaction to the COVID vaccine, the rate of reaction would be no higher in someone that has had reactions to other vaccines. So should be fine and low risk to go ahead.
Thank you so much. Question for you, Councillor Cressy. Someone wants to know how they can book a vaccine at the Scotiabank Arena and maybe missed that. What do they have to do to get there, please?
You bet. So the 2 options. You can do it by telephone, and I can tell you the number right now. It's 1-833-943-3900. That's 1-833-943-3900. Kind of felt like I was doing an infomercial there.
You are.
So 833-943-3900. You can also go to, if you visit toronto.ca/COVID-19, there you are right there. You can book it online. And so, as I say, there are 2,000 spots available. We just opened up this morning. We anticipate they're going to go quickly because this is one of those clinics that people want to be a part of, but that's how you book.
Great. Thanks for that. And I'm sure people are now leaving the webinar and going to dial 1-833-943-3900 to get a spot. There's another question for you, Dr. McCready. Someone's worried if their child is taking ADHD medication and they're wondering if there's any possible side effects in mixing the two. Is that something you can answer?
Yeah, so from everything we know so far from the kids and also from adults, there would be no issues with your child being on any ADHD medications or any other medications related to that and getting vaccinated. So perfectly safe. And we do know that kids, not necessarily with ADHD, but with other complex medical issues, are at higher risk for getting complications from COVID. So if your child does have complex medical conditions, it's even more advisable for them to get vaccinated so that they're going to be personally protected from developing severe symptoms from COVID. But there's been no concerns related to interactions between medications related to ADHD. So would recommend vaccination in that group as well.
Thank you. And just another from a parent whose daughter is 11, and you may have answered this, but just let's do it again. Is it better to wait until January? She's 11. Is it better to wait until January and get an adult dose, or book now and get a child dose? And if you get a child dose now, do you have the option to get the adult dose once you're 12? And what's your recommendation?
Yeah, good question. So I definitely would not wait. I would get the dose now, the child-sized dose now of the 10 micrograms. And then once your child turns 12, then for their second dose in 8 weeks, they could get the adult dose of the 30 micrograms. And so Health Canada and NACI have kind of poured over the evidence, and they've made that recommendation. And one of the slides that we showed basically the breakdown of the immune responses across the age spectrum. And the 11-year-olds that were nearly 12 had just as good of an immune response as the younger kids did. And so would still be advisable to give them that lower dose now. And it may even have a lower risk of side effects for them with that dose. And in addition, we're heading into the holidays. We are seeing rising cases within the city, within the schools, and across the province. So certainly, each week that goes by, there's going to be an increased risk they'll end up getting either exposed and then delaying that shot or actually getting COVID. So I would recommend not waiting and try to get that dose sooner for them if you've made the decision to vaccinate them.
Thank you so much.
Paula, can I just say,
yep.
Dr. Davila, who so many of you will come to know, our medical officer of health, who I work with, she always has this line, which is the best vaccine is the one that's soonest and most available to you. And so when it comes to vaccines, the one that is the soonest and fastest available is the best one, as Dr. McCready was just saying in this case.
Great, thank you for that. Rebecca's wondering if they will still have to parents will have to sign a daily health screen as part of children attending school if they're vaccinated. And I don't know if either of you know that answer, but there's a lot of parents here, school kids. So, but you happen to know that one?
So I mean,
go ahead. Sorry, no, you go ahead.
You both know this one, so you can both.
No, Joe might have a better answer than me. Go ahead, Joe.
Well, for the moment, the answer is yes. And so long as we continue to be in a state of a pandemic, mask wearing, daily screening, practicing being cautious remains a key part of our best protection, along with vaccines. But I think we can all look forward to the day, and this is part of the real opportunity with 5 to 11-year-olds, that our overall protection from vaccines, the more we're vaccinated, the sooner this will all end. And so the sooner we get vaccinated, the sooner we'll come to an end of daily screening and mandatory mask wearing. But for the moment, yes, those protective measures will remain in place.
Do you wish to add something, Dr. McCready?
Yeah, I agree with everything that Joe said. The one thing I would add is that, what we've seen for the kids 12 and up with the middle schools and the high schools is that if you're fully vaccinated and you're in an exposed cohort, then you don't get dismissed from school. So you're still able to continue school if you've had someone within your class, test positive for COVID and be at school during that time. But sorry, give me 1 second.
No problem, we're in your house.
But the under 11s, obviously the Ministry of Health or Ministry of Education and the school boards are going to be looking at this. But the hope is that, once the vaccines are broadly rolled out in this group, that kids will be able to stay at school and there won't be dismissals. And I think that's a huge thing to look forward to for our kids in this younger age group as well.
Thanks very much. Someone's just come on, and you answered this earlier, but are there any concerns when children are getting this at 11 in a prepubescent stage that will have any impact on fertility later on? And I know that's in people's minds. So could you address that one more time, please, Doctor?
Yeah, no problem. I think there's a couple things to break down in terms of long-term side effects in general and specifically fertility. And then, is there any going to be other unexpected things that pop up? So, I think there's a few things that are very helpful. So one, the mRNA technology has actually been around for a long time. So it's been around since the 1960s. And then they've been doing trials and giving vaccines with mRNA for flu and rabies back to 2013. So there is data that's, long-term that we haven't seen any impact there. We also also have the understanding of how the mRNA vaccine works. So once the mRNA goes into your system, goes and gets into the vaccine, it can't stay stable in your body for very long, and it just disintegrates and it's gone within 2 to 3 days. And then what we see is your immune response. So really any side effects that we would expect to see would be either in the acute period, a few days after the vaccine, or if it's related to that immune response within kind of 4 to 6 weeks, because after that, your immune system isn't building anymore. So in the history of of vaccines in general, and what we know about mRNA vaccines, there's really no precedence for seeing longer term, kind of years out side effects from vaccines, because they're just not in your system anymore and they can't cause that. So it would be exceedingly unlikely to see anything, out long term. Versus with infections, they can create an unchecked immune response and they can make you very unwell, versus giving a measured amount of vaccine that we know how it interacts with your immune system and it's been well studied. In addition, we have, literally billions of doses given of Pfizer given to 12 plus group worldwide. And we have good data, specifically talking about fertility. So good data on fertility in women around the world. So, no change in pregnancy outcomes, and actually a number of studies in people undergoing IVF that showed similar pregnancy outcomes in people that had the vaccine and didn't have the vaccine. So really wouldn't expect any changes in the younger age groups. And there have been reports, and people are looking at this as, changing of menstrual cycles after the vaccine, but there's no hormones in the vaccine. It doesn't actually change your hormones or your cycles in any meaningful way. It's really just related to inflammation and the shedding of the lining that month. And then the cycles go back to normal. So really nothing kind of either theoretical or from all of the evidence we have worldwide that there would be any concern that we would see a long-term issue with fertility in girls or in young women. So those are the reasons that, as a mom, it made me, comfortable vaccinating my young child, and that I'm happy to kind of share that, because I think the risk that we're going to see something is exceedingly low. And it's the same thing when you worry about, I saw a couple of questions, well, how do we know that something else long-term isn't going to pop up? And it's the same thing, kind of understanding how the vaccines work, and that really it would be so unlikely that something brand new would pop up. A few people mentioned about AstraZeneca. So that happened within 4 to 6 weeks of the vaccine. And again, we've had millions of doses gone through in people. And so if there was something, it would be exceedingly unlikely that we'd see something brand new pop up in kids that we haven't seen in any other age group. And especially with 3 million doses now given in the United States and no new safety signal at all. So yeah, the one thing, and sorry, I'll let you. And the only other thing is, I know a lot of people ask about myocarditis. So maybe I'll just touch on that, because I think that's a concern parents have. And so we do know especially in the 16 to 19-year-old group, there is a risk of myocarditis after vaccine, but it's almost always in young males after the second dose. And so, important to be aware of that risk, but for a number of reasons, we expect the risk to be lower in the 5 to 11 group. And so one is because myocarditis rates are lower in this group to begin with, and related to their age and their hormone levels. And the second is because the dose is lower. So we expect the risk to be lower. Plus, with this 8-week interval, the risk will be lower. And I think if anyone is, that's something that's on your mind and worrying you, again, almost always after the second dose. And by the time we're due for our second doses here in Canada, the one good thing about being behind the States is literally millions of kids will have received their second doses, and we'll have months of real life data to kind of be able to look at and really understand, okay, what that risk is and how low is it? And then you can kind of make that decision. So sorry, that was a lot, but I saw a bunch of questions that are asking about those things, so I thought I'd address them.
No, thank you very much, because there were some about AZ, and then there's a couple about fertility. So you really do have to let people know that you've thought about that, and there's data on that. The other one just coming in is if a child has minor eczema or reactions, skin reactions, would it be okay to give a Reactine or Benadryl or something after the vaccine in order to calm that spot?
Yeah, if your child has known reactions to that, that's fine. That won't cause any trouble or any change with their immune response to the vaccine. If you need to do that to treat other medical conditions, that would be fine.
Thank you. I see we're getting just to the end of the webinar, 8:05. This is a question we did ask that you answered that, Joe, about wearing masks or having to sign in. So will children be allowed to play indoors more or play with more kids, not have to wear masks or get their hands sanitized multiple times a day once they're vaccinated? Or did you say that those precautions will still remain intact for the foreseeable future?
So two things. I mean, first is for the next couple months, I think we should anticipate that we will continue to be in a cautious state. I mean, I think what Toronto has done so well is that not only have we seen vaccination rates really go up, but we've continued to practice some really good cautious approaches: screening, mask wearing indoors, being careful around some of those steps. Here's what I think we can look forward to is as our vaccination rates continues to go up for those over 12, but including kids, our overall protection as a city will go up, which will lead to the loosening of these measures. I mean, the way we get back to normal, the way we beat this pandemic is through ultimately vaccination. So we're not going to live in a perpetual state of daily screening and mask wearing. Vaccination is the path out of this, and I think we should anticipate that coming in a few months' time.
Thank you. Another one about, we asked earlier, if you're getting this 5 to 11 dose and then you turn 12, can you get the adult dose? And then there's a question, if you get the 5 to 11 dose and you turn 12, can you still get the second 5 to 11 dose? Is there a grace period where you could still get the smaller dose? Or is that a good plan or not a good plan?
Yeah, good question. So, I mean, I think it's that what Health Canada and NACI have advised is to get the adult dose once they're 12. But, you know, if you did really want them to get the smaller dose, I would speak to your physician, speak to the clinic. Health Canada and NACI have also said that if a child is 11 turning 12 and they end up getting 2 doses of the 10 microgram dose, as opposed to a 10 and a 30, then they would still be considered fully vaccinated. So I think if you have a specific concern, I think it would be reasonable for you to speak to either the clinic or your family physician or wherever you're going to get it. If you wanted them to get 2 of the 10 microgram doses. The 12-year-olds weren't officially included in the trial, but they likely would have, reasonable and robust protection at that level. It's just that we don't have data for that. That may be something we see coming up if kids end up receiving 2 doses at the cutoff. And if it's just a matter of a few weeks, it's unlikely to make a big difference. So they're probably reasonably, protected and have a good immune response with either the small or the large dose.
That's great. Thank you very much. And do you have any idea, Joe or Dr. McCready, how effective is the first dose of the vaccine when a child gets that? Are they pretty well protected from COVID, or is there a chance that they're not completely protected?
So, I mean, we know that even when you're fully vaccinated, there is still a risk of you could acquire COVID. The risk is much lower than someone that's unvaccinated. And there is obviously a much lower risk, a significantly lower, like at least 20 times lower, that you're going to end up, if you're an adult, end up hospitalized, and a 25 times reduced risk that you're going to end up in the ICU. So with 1 dose of vaccine, kids likely will still be able to get COVID. We don't know what that level of protection is because the study didn't see any cases between those 2 dosing intervals. But it would be very unlikely for your kid to get, very unwell or need to be hospitalized once they've had 1 dose of vaccine. But, leading into the Christmas season, people are saying, oh, can I travel? Can I do all these things? I think it goes back to, again, what Councillor Cressy has said, and what we all have kind of said over and over again, is it's really important to still do, it's a package, right? The vaccine is like the foundation and is really the most important thing. But at this stage, when we still have numbers and circulating virus in the community, important to wear a mask, wash your hands, stay home. If you're sick, get tested, all of those other good things, because the vaccine on its own, needs some help, basically. But it will provide, significant protection to reduce those risks.
Thank you. We just have a very particular question. We have a parent that's leaving the country, has a daughter who's not turning 5 until February, leaving the country for an extended period of time, and is worried about, could they get a vaccine beforehand? If they, how could they get back in? Is 6 months between doses too long? It's very particular. Would you have advice where somebody could get good answers to that question, either Joe or Councillor Cressy or Dr. McCready? Is there somebody who could, that's very particular, and that's traveling as well, and then getting back in and being comforted that your child is well vaccinated? Is that a family physician conversation? Is that,
Yeah,
where
so
did that
I,
answer come from?
yeah, I would reach out to your family physician or your pediatrician, and then they can hopefully help you navigate that. So, I mean, I think we kind of yet to see exactly what they're going to say for kids that are turning 5 in 2022. So if you're missing the cutoff by a few weeks, most places I think would be reasonable, and there'd be exceptions available under extenuating circumstances. But I'd reach out to your family physician, see what your options are. They can always reach out to one of the clinics nearby where you live, and see if there's any accommodation that can be made. And then in terms of the second dose and when, give me
That's
one.
okay. Please give your child a hug. That's right. We're in everybody's home. Thank you for having us. Thank you for being here from your house. I always say your kids are there, your family are there, your pets are there. We're in your house. So you just have to do what you have to do in your own home. No problem. Thank you.
And I'll just pick up while Dr. McCready's giving her kid a hug. I kind of wish I was doing the same thing. Is, as she was mentioning, children who turn 5 by the end of 2021 are currently eligible, and so that has not been opened up. But I can tell you from a entering the country perspective, while immigration policy is at the federal level, our country is not closing its borders to people who are returning home, and they've been very clear about that. While there may at that point be policies around testing as you enter, nobody should be concerned that they won't be able to return home. And I think we just need to reaffirm that.
Thank you. I'm just going to end on one last question, which has to do with the variant, because we've had people that have come on since. And what happens? How do we know if this is going to be helpful or successful to deal with the new variant that's just starting to develop? And always, it may affect travel plans, it may affect many plans. We don't really know much about it. What can you say about that, Dr. McCready and Councillor Cressy?
Well, I'm happy to kick it off. I mean, let me tell you first of all what we don't know, and I think what we don't know should give some comfort. This is a new variant that has emerged. The World Health Organization has identified it as a variant of concern, and this was identified only last week, and already around the world through active surveillance and genome testing, there we are looking at it. Here's what we don't know. We don't know the degree to which this new variant is more transmissible than previous variants. That's number one. Number two, we don't know the degree to which this new variant is potentially more harmful. Does it lead to more likely hospitalization? We don't know. And third, and I would argue perhaps most importantly, we don't know the degree to which this new variant evades immunity through vaccination. We don't know. And so we simply don't have the answers to those questions, which means now is the time for relentless monitoring, surveillance, testing. It's really a time, the longer it takes to vaccinate the whole world, the more likely we'll see new variants emerge. And so this isn't just about vaccinating everybody in our city, it's the whole world. But the simple answer on this new variant is we don't know. And as much as that can cause some angst, I hope it also causes some reassurance, because now's not a time for panic. And so we anticipate that within the next week to 2 weeks, we will be able to answer those questions as this is being monitored in real time. But for now, for us, it is to stay the course with being cautious, with doing testing, surveillance, and our vaccination drive while we seek the answers to those questions.
Thank you, Dr. McCready. Did you want to hop in on that?
I mean, I think Joe said it very well. I really don't have much to add. We really, this is very early stage. We're learning as much as we can. I mean, I think knowing what we do about the vaccines and about COVID in general, I think it would be very unlikely for it to evade vaccine immunity altogether. And so I still think it's important to keep pushing on all of the public health measures and on vaccination that we have, because, as we said, the more we can control this virus and prevent further mutations and prevent spread, it's only, that's only the upside, right? So I think we still have to keep focusing on all the good things we've been doing, and vaccine is one part of that.
Thank you. I know we've gone a bit over time, but I just did get one question that I'm going to ask you, Dr. McCready. It has a child that has epilepsy. Is there any danger in getting a shot for that with an increased chance of headaches or high fevers as a side effect? What would your recommendation be?
Yeah, so we would still recommend that for those children to get vaccinated. So again, the risk of fevers is low, and high fevers would again be unlikely in that group. And children with different neurological issues, including epilepsy, when you look at the data from kids that have had more severe disease, again, those groups have been included in there. So it would be higher risk that your child, if they got COVID, might have more complications. So would certainly would recommend that, obviously talk to your physician if you're worried about their specific medical issues, but would recommend that they would be able to get vaccinated as well, and it should be safe in them as well.
That's fantastic. Thank you. And thank you very much. There's tried to double up on a lot of the questions, and there were some current themes there tonight on the questions, and I hope that we got most of them answered for you. I would really like to thank our panelists, Dr. Janine McCready, and our Chair of the Board of Health, Councillor Joe Cressy. There's another picture there at the Scotiabank Arena coming up on December 12th, 2,000 spots on the ice. Who knows who might turn up, as well as Carlton. There may be some others turn up for that. I will post this as a webinar so that you can review it. And a lot of the questions that you had are really contained when you look at a lot of this information. It's very detailed from your slideshow, Dr. McCready. And I think we can just go through that and get a little more out of that, all of us. So I just want to thank everybody for attending. And I just have to thank once again our tireless champions in fighting this COVID-19, in helping us get through the pandemic, in giving us good advice, in working long hours, in attending webinars in their home when their kids are there and you can't spend that time with the nursery rhyme or help Jude in his bathtub. And we just have to thank you for that sacrifice. It's really quite amazing. So with that, I will say good night to everybody. Stay well, stay safe. Thanks very much.